It's me, Dr. Jagadeesh from Trivallur. I'm going to speak about understanding hypertension. Okay. What is hypertension and how is to prevent it? Generally, everyone would like to have a healthy or normal blood pressure. But what exactly does it mean? Basically, each time when the heart beats, it pumps blood into blood vessels. This creates pressure against the wall of the blood vessel. This is called hypertension. Okay. Normally, in healthy person, it rises and falls throughout the day. But when blood pressure remains high for a longer time and left untreated, it can lead to serious health complication. In general, persistent increase in blood pressure higher than normal blood pressure is known as hypertension. High blood pressure usually develops over time. It can happen because of unhealthy lifestyle. For example, not having enough regular physical activities, obesity, smoking, stress, etc. And other risk factor also is there. Depends on age and family history. Excess salt intake is also known to raise high blood pressure. Not eating enough potassium level, eating processed and fatty foods, and smoking. Another one is stress factor. Okay. Moving on, hypertension does not have any obvious sign and symptoms. That is why it's also oftenly called a silent killer. It puts people at risk for several diseases, from cardiovascular problem to kidney failure, stroke, and even eye damage and blindness. Hence, early and accurate diagnosis is very important in management of hypertension. Measuring the blood pressure is the only way to know whether person have high blood pressure or not. Okay. And then unfortunately, high blood pressure can easily diagnosed. It is usually measured with the instrument called sphygmomanometer. The blood pressure is recorded in two numbers, systolic and diastolic. Now let's tell what is systolic and diastolic. And the normal value for blood pressure is 120 by 80 mm of Sg, mercury. Okay, hence the upper number indicates systolic blood pressure and lower number 80, which means diastolic blood pressure. And systolic blood pressure, which means pressure in blood vessels when the heart contract. Whereas the lower number indicates diastolic blood pressure, means pressure in blood vessels where the heart rests between beats. Okay. If blood pressure level is more than 140 by 90 mm of Sg, then the person have hypertension. If person have BP level higher than this, then she might be risk of developing serious heart disease. Okay, this risk can be prevented and reduced by taking forward healthy lifestyle such as regular exercise, healthy diet, quit smoking, regular blood pressure monitoring, and stress management, and then adherence to medicines. Okay. In regular exercise and physical activities, generally when symptoms do occur, they include morning headache or tiredness, and then normal fatigue, nausea, and vomiting. If person is experiencing some of these symptoms, then one should get their blood pressure checked. Regular exercise also help you maintain a healthy weight, which is my opinion is as an important way to control blood pressure. Healthy diet, which means diet approach to stop hypertension. Eat rich in whole grains, fruits, and vegetables. Reduce sodium in your diet. Okay. Even a small reduction in the sodium in the diet can improve the heart health and reduce blood pressure by about 5 to 6 mm of Hg. Quit smoking. Stop smoking helps your blood pressure return to normal. Quitting smoking can effectively reduce your risk of heart disease and improve your overall health. And then fourth one, regular blood pressure monitoring. Some of the hypertension patients check their blood pressure by visiting doctors, but it is not always possible for patient to visit doctor and check up their blood pressure. Hence, most often I advise the patient self-monitoring of this BP level. Okay, and then stress management. By learning how to relax and manage stress can improve emotion and physical health and lower high blood pressure. And stress management techniques include exercise, listening to music, and then meditation. Okay, and then adherence to medicine. Medicine to lower blood pressure may be recommended by doctor if your blood pressure is continuously high, usually at above 140 by 90 mm of St. Adherence to medicine is very important as control your blood pressure regularly. At last, it would like to suggest that there is nothing more precious than having a fit and healthy life. Adapting healthy lifestyle can help us to enjoy the long and healthy life. High blood pressure can be prevented as well as controlled in many ways. Keep blood pressure in the normal range is very important in preventing cardiovascular complication. It is very much possible to maintain normal blood pressure level with regular monitoring and preventing care. Thank you.